So what do you think why me's question is all about? So what is this distress called about? Tap madilla. Howd. Why me? Nange yakke? Nanenu madilla. So we call this as spiritual distress. Okay? So this is what Karunashraya is all about. What is it? Maze of mirrors. So when you enter into maze of mirrors, what happens? Correct. There will be multiple reflections and you don't know where to go, right? Spirituality is all about this. So once you enter into spirituality, you don't know where to go. It has multiple dimensions, and for different people, the spirituality is different meaning, okay? Today, we see what is spirituality and what are the key spiritual concerns, and how do we identify and assess spiritual concerns, and volunteers' roles in spiritual care, okay? So, what do you as a volunteer understand by spirituality? Searching the right path, your belief system, surrender, purpose in life, fulfillment, reality, ray of hope. So if anything we have to understand, we have to define what exactly it is, right? So we will see now what exactly spirituality is about. So spirituality is finding meaning and purpose and connectedness to the self, inwards, which is inwards, self to oneself, self-realization, self-conceptualization, self-awareness. It's inwards. And connectedness to others, which is your family, your environment, your work, the nature, the art, whatever it is. It is outwards. And connectedness to the higher power. It may be God, it may be energy, it may be significant sacred, whatever it is. The higher power or your belief system. How is spirituality expressed? Through your beliefs, values, traditions, and practices. Is spirituality and religion are the same? It's not. So for some people, it may be the same. For some, it may be the different. Okay? So what is religion is all about? Religion is all about the traditions, right? And it is the collective, it is the group of people. It is taken, religion is the collectiveness, right? And it is human construction. It is not same for individual. It is collected in a group. Maybe it is Hinduism or Islam or Christianity. They have set of rules, regulations, customs, traditions, everything. It's a collective. Whereas spirituality is individual. It is different from, my spirituality may be different from yours. It is different to each person. It is searching the meaning and purpose. It is the transcendence, right? Religion may be, sometimes it is helpful to seek your spirituality, right? It can be a tool. So, in biopsychosocial models, there are 8 domains where spirituality is one of the main domain of biopsychosocial model. When a person has chronic illness, maybe like cancer, any other chronic illness, they have injury or disruption, the wellness is disturbed, right? Their health and wellness is disturbed. And there will be loss and suffering. What will they suffer? What will they go through? Distress. It may be psychospiritual distress. So how does spiritual distress manifest? The first question will be, why me? Right? So, why is this happening to me now? Then, what have I done to deserve this? Am I being punished? So, why am I being made to suffer like this? I don't deserve this. And is there a God? If so, He'll be there for me. And other questions will be, what will happen to me at the time of death? And what will happen after I die? Will I be remembered? Will my family survive the loss? Will I be forgiven? What about my loved ones? Will I be able to finish my life's work? So, how does spiritual distress manifest? There are so many psychological concerns, right? So, despair, disconnect, demoralization, helplessness, hopelessness, meaninglessness. There is no meaning in my life. I have got this chronic illness. What will I do? Feeling of abandonment and isolation, desire for hasten death and euthanasia. Most of the patients, they ask, right? Do you have any medication for me to die? Feelings of anger and betrayal, anger on God. He has betrayed me. what is called Tumba Bhakta Nan Devar Bhakta. So he has given me this cancer. It's a betrayal, anger, expression of loss of identity, and physical symptoms not responding to routine therapy, and patient acting out of refusing or to cooperate, and patient's denial, non-adherence to treatment. You have seen in many of the patients, right? Yen madod matre tagondu. That is of no use. So what are the key concepts in spirituality? So there is a global meaning why this disruption of what happens when the disruption of meaning and values. There are global meanings. For example, for a housewife, taking care of the house, cooking for the family, taking care of the children, taking care of husband is her meaning, right? So there are many global meanings, beliefs, systems. For example, so word is fair. This is what we think, right? Word is fair. God is just and fair. Bad things happen to only to the bad people. Bad things don't happen to the good people. Eat right food and we won't be sick. And think positive to overcome anything. Suffering is a punishment for sins when this global meaning is disturbed. For example, there is a cancer, is disturbed by the cancer. What happens? What happens to the global meaning? It will become situational meaning, right? What will it will change? So I have not done anything wrong. Why am I being punished? So here, for example, God is just and fair. The situational meaning will be, why has God been unfair to me? Right? So I have always looked after my health. Why did this happen to me? When this happens, what will happen? So they'll be in distress. So when the distress comes, what will happen? So search of meaning. Why? Why this happened to me? The why question comes. Search for meaning. Then how process, how it is. Meaning making, the process, how it will be done. So then when the meaning is made, they'll derive that through that meaning. This is karma, God's way of testing me, right? When this is answered, again, they'll come to the first stage where their distress ends there. So they know how to overcome this spiritual distress. Yes, this is the acceptance, the process. So why the first will be why this has come to me. And then the meaning making, the how, the process, how it will be done, what is it. And then the meaning, when they have derived the meaning from that, then the distress will come to end. They have accepted that situation. Disruption in dignity. So this dignity is categorized into themes and 3 dimensions, which is physical, psychological, and social. So level of independence, cognitive acuity. So what is it? So the mental, processing, and clarity, right? Then functioning capacity, which is again physical, how much they can do their daily activities. Then symptom distress, which is psychological. Medical uncertainty. Then death anxiety, facing the death or the mortality. So dignity conserving repertoire, dignity conserving perspectives, continuity to self, role preservation. So sometimes what happens when the mother gets cancer, what happens? You are a patient, you are not supposed to do anything. Her identity is gone there, right? So preserving that role. Then generativity and legacy. Leaving legacy for the next generation. And maintenance of pride and self-respect. Then hopefulness, autonomy or control. Control about one's life. Somebody is controlling my life. I'm not able to control it, right? This is the dignity concern. So acceptance. Then resilience or fighting spirit. Then dignity conserving practices. Living in the moment. Living in the present. Not thinking about the future. Then maintaining normalcy. Seeking spiritual comfort. Solace in finding spirituality through prayers and religious practices. Then social dignity inventory. Privacy boundaries. So social support. As sir was asking some questions like how much I have to do for the patient, whether I have to go to their home or they're asking for so many visits. So you have to maintain your professional boundaries, which is more important. Otherwise, you will be in the distress. So care tenure, it's again for the caregivers. Caregivers' attitude towards the patients. So building a burden to others and aftermath concerns. Like as he said, property issues. So once I pass away, what happens to my loved ones, or what happens, who will take care of them. That we call it as aftermath concerns. What are the spiritual needs? So meaning and purpose within the illness experience. Then peace of mind and freedom, pervasive fear of dying. Love, belongingness and coherence. Realistic hope. Giving realistic hope is important. Sometimes patients will be asking, like, will this be cured? Will I be okay? So sometimes what others will tell, what the counselors or the doctors will tell, parvagilla, chanag agbidtira. Is that the realistic hope? That is unrealistic hope. So faith and belief systems help them to cope with the challenges of the disease. Search for a guide. So sometimes it's very difficult, right, to address their spirituality. So sometimes it's very difficult. Maybe they ask religious questions or any spiritual questions which we may not be able to answer since we are not trained. So what we have to do, search for a guide to help them make sense of what is happening to them as death draws near and make most of the time left. So spirituality and suffering. So pain ಮತ್ತೆ suffering ಏನು ವ್ಯತ್ಯಾಸ? ವಾಟ್ ಇಸ್ ಪೇನ್ ಆ್ಯಂಡ್ ವಾಟ್ ಇಸ್ ಸಫರಿಂಗ್? ಈಗ ನಾನು ಟ್ಯಾಟೂ ಹಾಕ್ಸ್ಕೊಂಡಿದ್ದೀನಿ. ಐ ಆಮ್ ಹ್ಯಾವಿಂಗ್ ಎ ಪೇನ್ ಆ್ಯಂಡ್ ಐ ಹ್ಯಾವ್ ಅ ಕ್ರಾನಿಕ್ ಇಲ್ನೆಸ್ ಕ್ಯಾನ್ಸರ್. ಐ ಹ್ಯಾವ್ ಎ ಪೇನ್. ವಾಟ್ ಇಸ್ ದ ಡಿಫ್ರೆನ್ಸ್? ದಿಸ್ ಇಸ್ ಜಸ್ಟ್ ಪೇನ್ ಆ್ಯಂಡ್ ದಿಸ್ ಇಸ್ ಸಫರಿಂಗ್, ರೈಟ್? So spirituality and suffering. So what is it? So we have as a total pain, we consider as a total pain, right? We don't consider only physical pain as a pain. We have psychological pain, physical pain, spiritual pain and social pain. So spirituality transcends all domain and influences the experience of suffering. Well-developed spirituality allows patients and families to cope more adequately, experience better well-being, experience less distress, hopelessness, and hastens death and improved quality of life. So a good death honors the whole of life, physical well-being, material affairs, human relationship, and spiritual needs. This statement is given by Dame Cicely Saunders in 2001. So spiritual well-being and health. When your spiritual well-being, not only in chronic illness, even for us, if our spiritual well-being and health is at good, what and all happens? Extended life expectancy, right? When our spiritual health is good, so extended life expectancy, lower blood pressure, so lower rates of death from coronary artery disease. This is the research which has done. Okay, so reduce cholesterol levels, reduce levels of pain in cancer sufferers, or reduced mortality among those who attend church and worship services, and increase longevity among the elderly, reduce mortality after cardiac surgery. When our spiritual health is good, then these are the advantages we get, maybe with the patients who are suffering or with us. Okay, so spirituality influences decision making, isn't it? Beliefs are related to person's cultural background and spiritual or religious belief. So greater spiritual well-being was associated with less decisional conflict, decreased uncertainty, a feeling of being more informed and supported, and greater satisfaction with one's decision. Surrogates use religious and spiritual coping for decision making. So how can I address spiritual distress as volunteer? ಇದಲ್ವಾ ಬೇಕಾಗಿರೋದು. ಸೊ ಹೆಂಗೆ ಏನು ಮಾಡ್ಬೇಕು ನಾನು ಆ್ಯಸ್ ಅ ವಾಲಂಟಿಯರ್? ಹೆಂಗೆ ಅಡ್ರೆಸ್ ಮಾಡಬೇಕು? ಇನಿಷಿಯಲ್ ಸ್ಕ್ರೀನಿಂಗ್. It will take less than 2 minutes to take the spiritual history. And all members need some training. Without training, you won't be able to address any spiritual concerns of the patient. Alva? You end up doing more harm if you don't know anything about it. Include professional trained in spiritual care in the multidisciplinary team. So, assessing spiritual distress, spiritual assessment is a conversation. It's just a conversation between you and the patient, or you and the family members, in which the patient is encouraged to tell and explore their spiritual story. ಏನಾಯಿತು ಚಿಕ್ಕ ವಯಸ್ಸಿಂದ ಏನಾಯಿತು ಅಂತ ಕೇಳಿದಾಗ, if you ask their story, they'll narrate you better, right? It's most of the time, it's patient-centered approach and evidence-based approaches to care. So there is one, Google al sigate, FICA anta. So where FICA stands for, F stands for faith, belief and meaning. So there are questions regarding the faith, which is important for them and which influences them, and community, connectedness, and address in what do you want you to address it. Volunteers' roles in spiritual care. Spiritual care are interventions, individual or communal, that facilitate the expression of spiritual concerns and fosters the integration of biopsychosocial spiritual domains to achieve wholeness of health and connection to self, others and higher power, right? What is spirituality is all about? The connectedness, right? To self, to the inwards, to the outwards and to the upwards. So interdisciplinary palliative care model progress the inclusion of spiritual domain in the overall screening and history taking process. Spiritual intervention should be tailored to the patient's or family's worldly perspectives. Tumba important. Nam spirituality vere irutte and their spirituality is different, right? You have to tailor according to their beliefs, right? You can't go and tell your spiritual illa id hige anta helakagalla. So it's tailored to the patients and families' worldly perspectives, what they see, what their culture, what their religious, what their belief system. It all depends on the patients and their families. Okay? Spiritual interventions are contraindicated in those with psychotic illness. Madakagata, the patients who have psychiatric illness, do you go and ask? If they come and ask me why, is it fair to address them? It's very difficult. Their spiritual distress, you may worsen their spiritual distress, right? So be mindful. So there is one case which I'll present you, the story of Miss Urmila. So she was 48-year-old unmarried lady working as a social worker, presented with advanced metastatic endometrial cancer on treatment since the last 5 years. So living with her parents and a younger brother with disability. So she is the breadwinner of the family. Strained relationship with the two married sisters because they both got married first and she's the elder one who didn't get married because to take care of the family. So progressive decline in function. She's unable to get up from the bed. She's confined to the bed now. She's bedridden. So constant complaint of pain. Because of pain, she's unable to sleep. And she had breathlessness also. So frequent visits to the hospitals. So anger at her sister. Now one of her sister has moved from her husband's place to her place to take care of her. So she's getting angry on her, angry on the caregiver. So she's irritable. She's angry with the doctor, irritable with the doctors whenever she visits to the hospital. So these are the points. When we spoke to her, these are the things she expressed. Okay? I was working to help others' patients. I feel useless. So I have always done the right thing. Why did this happen to me? Then I have stopped praying. This is what God gave me for praying. I hate not being able to do my own work. I have always been independent because she was a social worker and used to help so many people, right? And I'm living with my parents. I don't know what they will do. Again, aftermath concerns. So I wish I had listened to the doctor and got the PET CT done earlier. So when patients say all these things, when you talk to the patients, you have to derive what exactly the spiritual distress is all about, right? She says, I was working to help other patients. I feel useless. What does she mean there? Meaning and purpose, right? So I have always done the right thing. Why did this happen to me? Belief system, correct. So I have stopped praying. This is what God gave me for praying. Anger at God, loss of faith and trust. I used to believe in God. Now our belief system has changed, right? So I hate not being able to do my own work. I've always been independent. What is that? Loss of control, right? Dignity. So I've never got along with my sister. Now I have to depend on her. Reconciliation, right? She don't have any other choice. She has to reconcile with her sister. She was angry on her. Now she doesn't have anybody to support her. What she has to do? She has to reconcile with the sister. I'm living with my parents. I don't know what they will do. Aftermath concerns. Who will take care of my parents, right? And I have a brother who is disabled, right? Who will take care of him? I know I don't have much time to live. I wish it happens fast. Hopelessness there. So I wish I had listened to the doctor and got the PET CT done earlier. Regret and guilt, right? So I used to attend satsang every weekend. Now I feel hardly I go. What is it? Connect with others, right? These are the you have to identify with the patient what they are trying to tell you, right? It's when they ask you all these questions, right? Why am I not able to go? I was doing this, I was doing that. You have to able to recognize what they are saying, going to tell you out of that, right? see this, when you derive that, what exactly is the meaning, then you can connect with them better, talk to them better, address to them better, right? So what do you see in Urmila? So what happens when something is tangled or when something is broken? What do? Correct. You will remove the knot. You untangle it. What will you do with the broken? Whatever is tangled, you can untangle it. But whatever is broken, you can sharp from that and start from there. You don't have to go and fix anything here. You no need to attach with a glue or something. It's already broken. You don't have to go when the patient asks you about why me questions or the spiritual questions, you don't have any answer. They have their own answers. You have to take it out from them. Why do you think so? Why are you asking this question? What is making you to ask this question? So you have to sharpen that edge and reuse it. So spiritual care. The attitude of the counselor, that's what I said. Spiritual care. That's okay. You no need have to answer their questions. There are no answers for any spiritual questions asked. So you have to be there. That's okay. So attitude is more important. Unconditional positive regard, non-judgmental attitude. And most of the times what we do, we judge them. And we try to put our belief system into them, right? So be empathetic and compassionate understanding. And congruence, authenticity, and genuineness. So there is no specific tools or anything. Technique is to ask, tell, and ask. You have to keep on asking the questions to the patients, why they think so. They tell you. It's like a life review. So you keep on asking them, they keep on answering it to you. So compassion listening, which is most important. Most of the time, we don't listen. We listen to answer. So compassionate listening, the emotional space created between two people. Your focus is to listen with your ears and your heart without fixing, without opinion. You just listen, right? That's what they need. They want somebody to vent out. That's what you are giving, that emotional support to them. Just listening, just being there for them. Active listening and respectful silence. Patient is not looking for any answers here. So what is spoken as spiritual questions is more often not a question, but an expression of spiritual pain. Do not judge. Do not impose your own explanations or reasons. Reflectively guiding, facilitate life review. As I said, everyone wants their story to be heard. So ask them, what is making them feel like this? So sense of healing is the context of the relationship with the clinician. Transformation healing. It is called transformation healing. So compassionate presence, being there. Sometimes what happens, we will be with the patient and thinking something else, right? ಆ ಪೇಷಂಟ್ ಇದ್ದಾರೆ, ನೆಕ್ಸ್ಟ್ ಅಲ್ಲೋಗಿ ನೋಡಬೇಕು, ಅಥವಾ ಮನೇಲೇನೋ ಇಟ್ಟು ಬಂದುಬಿಟ್ಟಿದ್ದೀನಿ, ಸೊ ಲಾಕ್ ಮಾಡಿದ್ದೀನೋ ಇಲ್ವೋ. ಸೊ ಕಂಪ್ಯಾಷನೇಟ್ ಪ್ರೆಸೆನ್ಸ್ ಇಸ್ ಮೋರ್ ಇಂಪಾರ್ಟೆಂಟ್, ಬೀಯಿಂಗ್ ದೇರ್ ವಿತ್ ದೆಮ್. ಸೊ ವಾಟ್ ಈಸ್ ಮೋಸ್ಟ್ ಇಂಪಾರ್ಟೆಂಟ್ ಇಸ್ ನಾಟ್ ದ ಆನ್ಸರ್ ವಿ ಗಿವ್, ಬಟ್ ದ ಪ್ರೆಸೆನ್ಸ್ ವಿ ಆಫರ್ ದೆಮ್, ರೈಟ್? ಬೀಯಿಂಗ್ ದೇರ್, ಹೋಲ್ಡಿಂಗ್ ದೇರ್ ಹ್ಯಾಂಡ್, ದಟ್ಸ್ ವಾಟ್ ಇಸ್ ದ ಮೋಸ್ಟ್ ಇಂಪಾರ್ಟೆಂಟ್. That we are able to have compassion for where the questions come from, that we can understand it, that we can companion a person in the midst of that kind of anguish, agony, pain. Because even though we are not giving an answer, being there is the answer. So a supportive presence for those who desire to be accompanied. So purposeful conversations. Invite the patient to share about his or her spiritual beliefs, values, or practices if the patient wishes. Alva? Keltira? What do you ask? Do they answer? Okay. Few people, they answer. ಏನು ಮೇಡಮ್ ಸ್ಪಿರಿಚುಯಾಲಿಟಿ ಅಂದರೆ ಕೇಳ್ತಾರೆ. ವಾಟ್ ಯು ಆನ್ಸರ್? ಸೊ ಕೇಳ್ತಾರೆ, ಏನು ಮೇಡಮ್ ಸ್ಪಿರಿಚುಯಾಲಿಟಿ ಅಂದರೆ? ಮೋಸ್ಟ್ ಆಫ್ ದ ಪೇಷಂಟ್ಸ್ ದೇ ಡೋಂಟ್ ನೋ ವಾಟ್ ಇಸ್ ಸ್ಪಿರಿಚುಯಾಲಿಟಿ ಇಸ್ ಆಲ್ ಅಬೌಟ್. ದೇವ್ರನ್ನ ನಂಬ್ತೀರಾ? ಸೊ ಲಿಸನ್ ಫಾರ್ ಸ್ಪಿರಿಚುವಲ್ ಥೀಮ್ಸ್ ಇನ್ ದ ಕಾನ್ವರ್ಸೇಷನ್ ವಿತ್ ದ ಪೇಷಂಟ್. ಐಡೆಂಟಿಫೈ ಸ್ಪಿರಿಚುವಲ್ ರಿಸೋರ್ಸಸ್ ಆರ್ ಸ್ಟ್ರೆಂತ್ಸ್. ಮೋಸ್ಟ್ ಆಫ್ ದ ಟೈಮ್ ಬೀಯಿಂಗ್ ಒಂದು ಫೋಟೋ ಪಿಕ್ ಆಫ್ ಅ ಗಾಡ್ ಇಸ್ ಮೋರ್ ಇಂಪಾರ್ಟೆಂಟ್, ಆರ್ ಪ್ರೇಯರ್ ಇಸ್ ಮೋರ್ ಇಂಪಾರ್ಟೆಂಟ್. ಕೆಲವು ಸರಿ ದೇ ವಿಲ್ ಬಿ ವಿತ್ ದ ಮಾಲಾ saying Hare Rama, Hare Krishna, or with the cross and with the mala. That is more important, right? Spiritual resource, those are the strengths the patient has. Identify spiritual issues or a spiritual diagnosis that affects the patient's illness or health or the patient's healthcare decision making or choices. ಕೆಲವು ಸರಿ ಪೇಷಂಟ್ಸ್ ಹೇಳ್ತಾರೆ, ಇಲ್ಲ ಮೇಡಮ್ ನಂಗೆ ಕೀಮೋ ತೊಗೊಳಕ್ಕೆ ಆಗ್ತಾ ಇಲ್ಲ, ತುಂಬ ಪೇಯ್ನ್ ಆಗ್ತಾ ಇದೆ, ನಾನು ಇವತ್ತು ತೊಗೊಳಲ್ಲ. ಏನು ಹೇಳ್ತೀರಾ? ಇಲ್ಲ, ನೀವು ತೊಗೊಳ್ಳೇಬೇಕು, ಇದು ನಿಮ್ಗೆ ಇಂಪಾರ್ಟೆಂಟು, ಇದು ತೊಗೊಂಡ್ರೆ ಆಗತ್ತೆ. ಕರೆಕ್ಟ್. ಫಸ್ಟ್ ಯು ಅಂಡರ್ಸ್ಟ್ಯಾಂಡ್ ವೈ ದೇ ಡೋಂಟ್ ವಾಂಟ್ ಟು ಡೂ ಇಟ್, ರೈಟ್? ಯಾಕೆ ತೊಗೊಳಕ್ಕಾಗ್ತಿಲ್ಲ, ಯಾಕೆ ಹಂಗೆ ಹೇಳ್ತಿದ್ದೀರಾ? ಡೋಂಟ್ ಯು ಆಸ್ಕ್? ಸೊ ದಟ್ ಈಸ್ ಮೋರ್ ಇಂಪಾರ್ಟೆಂಟ್. ಐಡೆಂಟಿಫೈ ಅಪ್ರೋಪ್ರಿಯೇಟ್ ರೆಫರಲ್ಸ್ ಆ್ಯಂಡ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಆರ್ ಕೇರ್ ಪ್ಲಾನ್ಸ್, ರೈಟ್? ಮೋಸ್ಟ್ ಆಫ್ ದ ಟೈಮ್ಸ್ ಇಟ್ಸ್ ವೆರಿ ಡಿಫಿಕಲ್ಟ್ ಟು ಹ್ಯಾಂಡಲ್. ಸೊ ಇಲ್ಲ, ನಾ ಹ್ಯಾಂಡಲ್ ಮಾಡ್ತೀನಿ ಆಗಲ್ಲ. ಮೋಸ್ಟ್ ಆಫ್ ದ ಟೈಮ್ಸ್ ಇಟ್ಸ್ ವೆರಿ ಡಿಫಿಕಲ್ಟ್, ರೈಟ್? ಆ್ಯಸ್ ಸರ್ ಸೆಡ್, ಮೆಡಿಕಲ್ ಪಾರ್ಟ್ ಇರ್ಬೋದು, ಅಥವಾ ಮೋಸ್ಟ್ ಆಫ್ ದ ಟೈಮ್ಸ್ ಸ್ಪಿರಿಚುವಲ್ ನೀಡ್ಸ್ ಇರ್ಬೋದು. So we are not that trained. So what we have to do, we have to give the proper referrals. Doctor medicine part ಕೇಳ್ತಿರ್ಬೋದು, ನಾನು ಈ ಮಾತ್ರೆ ತೊಗೊಳ್ರೆ ನಂಗೆ ಹಿಂಗೆ ಆಗ್ತಾ ಇದೆ, ಯಾಕೆ ಹಂಗೆ ಆಗ್ತಾ ಇದೆ, ಡಾಕ್ಟರ್ ಹತ್ರ ಕುತ್ಕೊಂಡು ಮಾತಾಡೋಣ. It's more important because we are not trained for that. Doctors are the professionals or the expertise who can answer to that question. So identify resources that may be appropriate for integration into patient's overall care plan. So there are 5 things. Spiritual suffering is real, but can be difficult to recognize and treat. Spiritual suffering can be translated into physical or psychological complaints. Alva? Most of the times they come with physical complaints. Nan matre tagolak aagta illa, nange pain aagta ide. Asking them why question is more important. Yak hang ansta ide nimge? Knowing what they are going through is more important. It's art and science. Awareness is the key of one's needs as well as a patient's needs. You also should be aware, correct alva? Nim boundaries agli, professional boundaries agli, ಏನು ಕೇಳ್ತಾ ಇದೀವಿ, ಏನು ಮಾಡ್ತಾ ಇದೀವಿ, you should be aware. You also should be aware. So interventions focus on aspects of meaning making, dignity, hope, connectedness and coherence is important. So I read this quote, helping, fixing and serving represents 3 different ways of seeing life. When you help, you see life as weak, right? So when you fix, you see life as broken. When you serve, you see life as a whole. So fixing and helping may be the work of the ego, and service is the work of the soul. So this is how I conclude patienthood to personhood. We always see patient as a patient. Sometimes patients ask for, in Karunashraya we ask what do you want? ಏನು ಮಾಡ್ಬೇಕಂತೀರ? They ask, ನಾನು ದೇವಸ್ಥಾನಕ್ಕೆ ಹೋಗ್ಬೇಕಂತಿದೆ, ಮಗ ಬರ್ತಾ ಇಲ್ಲ ಕರ್ಕೊಂಡು ಹೋಗೋಕ್ಕೆ. We arrange for that. Sometimes patient needs the diversion. They like pets. This is the pediatric patient which I handled. He liked that puggy very much. We asked some of the volunteers whether they had any puggies. We got that puggy there. He was so happy that day. And birthday celebrations. So most of the patients at home, they don't celebrate birthdays, right? So when they come here, we do celebrate birthdays and they'll be so happy. And this is one of the patient aftermath concern, right? Where he wanted to gift a sari to his mother where he couldn't because he's not working and there is no financial support. Our counselor helped them to buy a sari. He gifted that to the mother and she was so happy and she kissed her son. So this is another patient who didn't know how to write. In her life, she has not hold that pen or the pencil in her hand. So another patient helped her to write her name. So they both wanted to get certificate for that. We actually arranged for that. And this patient she was a veena player. Now I'm not able to get out of the bed and that was my passion and now I can't able to like play the veena or do whatever I want. So we asked one of the volunteer to bring veena, play for us, and she also played. Look at the joy she had. And this one patient painted the diyas. So it's a devotional activities for them to convert pain, come out of the pain. So patienthood to personhood. That is what spirituality is all about, right? Thank you. Any questions you can ask?
Many times the patient had asked me this question. So we didn't have the luxury of having volunteers with us, so we directly had to answer their queries.
Okay.
So there is no one answer to this question.
Correct.
So we have to devise our own ways of answering. So sometime I used to tell them that, did you have a good moments in your life? And most of them will say yes. So did you ask them why me at that time? So obviously they will have no answer to this.
Most of the time this why me questions come when the distress is
that's
there.
why I used to tell them that good things come, bad things come. So life is part of both. So when the good things came, you never asked this question.
Correct.
So why you are asking now? Accept it, because you accepted the good thing without asking. Now accept it as such.
Yeah.
So
for accepting also, they have to go through that grief cycle.
So this is not an easy
task for them.
But this is the way I used to.
Correct.
And sometimes we have to ask them whether they believe in karma and all those things. We directly don't tell them that this is bad karma.
Right.
But we ask them that,
It is our belief.
yeah,
This-
so do you believe in karma? Or do you believe in rebirth?
Correct.
If they say yes, then the next question, do you believe in karma? So maybe you have done something, now you try to do something good. So that way I used to counsel them according to my knowledge.
Okay.
I don't have much spiritual knowledge, but this is what I used to.
Thank you, sir, for the opportunity.
Yeah. May I request Amrinder to just give her a memento?